But first tonight, for the first time in Nigeria's history, babies are receiving vaccines against the dreaded malaria disease. The malaria vaccine is now part of Nigeria's national routine immunization schedule, with the first shots given in Kebbi and Bayelsa states set to be the worst hit by the disease. The National Primary Healthcare Development Agency says vaccines were administered to children aged 5 months to 15 months as part of routine immunization. The government says the second phase will target 19 states and the Federal Capital Territory, while the third phase will target the remaining 15 states. Now, both phases are scheduled for 2025. It marks a significant step in Nigeria's efforts to eliminate malaria, which kills hundreds of thousands of people every year.
Well, we're now being joined by Dr. Garba Rufai, who is the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Thank you so much, Doctor, for joining us on the news tonight.
Yeah, thank you for having me.
Well, this is a good step, and we've just been told why Kebbi and Bayelsa states have been selected because of the severity of cases in those states. But given Nigeria's status as one accounting for the most number of cases and the most number of casualties globally, why are we reduced to just 2 states? Is it a problem of affordability or availability of the vaccines? Why just those 2 states?
Let me put it like this. Let me bring it on context into it. So we do not produce the vaccines, right? So we have a donation. We've been pursuing this introduction for a while now, and we've got a donation of 1 million doses. And looking at the population, if we actually need to go full scale, we're looking at close to maybe 40 to 50 million doses, because the vaccine is 4-shot series. So we've looked at the data, and the science is telling us that, okay, we have Kebbi that has a very high prevalence, over 40% of prevalence in Kebbi State, and also for Bayelsa State also has a high prevalence in the South. And we looked at it, and we looked at what we have right now, considering the production lines and when the vaccines will now be available, talking of the future. And we've managed, so we're able to streamline to say, okay, let's start from these 2 states. So this is just the first phase. So this is phase 1, just like you mentioned. There's going to be a phase 2, and then phase 3 in 2025. So yes, the vaccines will go to these 2 states, or rather they're in the 2 states right now, but we will still move. Once we get more vaccines, we'll move to the other states.
But you're just taking it one step at a time. Like you said, that's just phase 1. We're expecting phase 2, phase 3 in 2025. Is there a more specific timeline to expect for phase 2 and phase 3, like quarter 1, 2, or 3? And also, the vaccination process started today. Can you tell us how that went? How was the process? How did people, the mothers that came with their babies, how did they receive it, and how did it go? Did you encounter any sort of challenges?
I don't look at things like, I don't call them challenges. So what we have today for us is very historic. You know, malaria is everybody's problem in Africa and all of that. So in Kebbi and Bayelsa State that we started today, it's really, really exciting. I'm just sad. I'm supposed to be in Bayelsa actually, but we have to go with my chief executive to Bauchi tomorrow. So it's very difficult to juggle these flights and all of that. So I had to stay back while I sent some of my deputies to go there. For now, I will tell you that the vaccine has been widely accepted. We're not hearing anything unlike most of those other vaccines you keep hearing, infertility, and no. Everybody came out. The picture that we showed here was the first child that was vaccinated in Kebbi today, and you see she had to stay back. Everybody wanted to meet the child and all of that. So yeah, this particular child.
Great, fantastic. So let's talk about the vaccine itself. How much do we know about it? You said it's a 4-shot series, so this means that they will get 4 shots. Any reactions to it? Are there reactions to it? And what is the coverage? Because we do know that with vaccines, some vaccines sometimes immunity can wane. There are reports in some cases of age shifts. So as the children grow older, the vaccine no longer covers them. Is this the case with this vaccine? Would there be an age shift issue? But what's the coverage for immunity?
So for herd immunity, usually we use 80%. Like this is it. But what we're looking at, we're going to base this based on population of the children, and we're working with our donors who gave us this vaccine to ensure that we have adequate quantity for the next phase. In terms of waning, I don't want, for coverage more like is, we aim to get 80% to get what we call this herd immunity, where like 80% of the population.
What are the numbers in terms of population for the brackets, age brackets? For the 80%, what is the number for that 80% of Nigerian children you're looking at to get herd immunity?
So we have children, we have 20% of the population of Nigeria children under 5, which is our main target for now. So looking at 80% of that, we're probably looking at close to maybe like 40 million, so to say, for under 5. But specifically, I'll just shift to the age range that we're actually giving the vaccines to now, starting from children 5 months to 11 months. We're looking at how it spreads. The last dose is actually at 15 months. So the idea is the child starts at 5, takes like on a 28 days basis, takes second dose, take the third dose. And something that we need to say here is that taking one shot does not actually give you the kind of protection that we aim to achieve.
You need to take the 4.
Yeah, you need to take the 4 shots to get that long protection over time. Yes. For malaria vaccine, science have shown that there's been a follow-up of over 7 in countries where they've started the vaccine. A 7-year study that was done showed like it waned like after the 40.
As they grew older,
yeah, after the 4th year of taking the vaccine. So the child will probably be getting to the 5th year and coming out of that dangerous phase where malaria is really, really a problem. We know that children under 5 and pregnant women are the most vulnerable and most at risk for malaria infections, and they easily get complicated malaria.
You know, these are very important information for the public to understand when they're taking part in this. We have this initial rollout in Kebbi, Bayelsa, which might be easier to manage, but with the national prevalence rate, and you have like high percentages in some regions, how would this distribution process, or how will we be able to ensure a more equitable distribution process and access, especially as additional doses are awaited for these next phases, as it's expanding to 15 states first and the FCT, and then the remaining 15 states after?
Yeah, so one thing I can tell you about the current administration of the Honorable Coordinating Minister and my Chief Executive is, the watchword here is accountability. Everybody is held accountable for their actions or inactions. What we do normally, this is just one of the vaccines that we're rolling out. It's a very tedious process where every hand must be on deck. We work with the partners, not just us, we work with the state folks also. They have the Ministry of Health, they have the State Primary Healthcare Board. We have footprints in almost every village with the primary healthcare structure that we have. So mostly what we've been able to do is to do what we call a forecast, to look using the population as we know, to actually project the quantity that will be required. And this will be distributed by states. And each state will be allotted this specific portion, and the vaccines are tracked from when they leave the airport till they get to the state. And also tracked at the local government levels. Then we also do what we call a weekly report. Then we do what we call the monthly report, which we check with what came from the week report and also looking at what's now coming out from the monthly report. And that we actually have to talk to the states about. If there are any discrepancies or things that are unclear, yes, we go and sort all of those out, and people are held accountable. And we also look at what the performances are. We help them, we support them to develop state-specific and contextual work plans that will work. Like what will happen in Bayelsa, in terms of the transportation of the vaccines in Bayelsa. Bayelsa started using the zip line, drones to move medicines and vaccines, and also use both. In Kebbi, it's mostly dry land, except for maybe about 3 LGs that actually have to cross the river and all of that. So all of this has been taken into consideration. The resources have been provided for folks to actually go there, and the health workers have also been retrained in terms of how to give the vaccine, what to expect. You talked about side effect. We call it adverse event following immunization. These are known. The vaccine is not particularly new. Yes, it is new in Nigeria. We have about 10 countries, so to say, Ghana, Benin Republic, Burkina Faso, they've already introduced this vaccine.
So you're talking about
Cameroon.
swelling at the needle sites?
So things like that, like pain, some fever, yes.
Okay, you already specifically mentioned that this particular vaccine is for children.
Yeah, for now.
For now.
Yeah,
And
that's
we're
what
looking at,
we can do
the
now.
adults would really love to have this vaccine
Yeah,
as well.
pregnant women would love to
Okay,
give
so
that
this
to
is for
pregnant
5
women.
to 11 months old, as I understood you said.
So the entry period, entry into the vaccination regime, because you need to go 4 doses. Like I said, the last dose is on 15 months.
Yes,
when
great.
the child gets to 15
But the
months.
first
So
entry-
yes, if a child is 5 months, yes, you could start 6 months, yes, you could start all the way to 11 months.
Yeah.
So, so the child will still get the 4 doses after 15
If you
months.
can just specifically tell us the spacing period for these 4 shots, so that we have those clear information, the period in between. But I also wanted to ask, so that we don't forget, because I asked about the coverage of this. You did mention that a study had shown a 7-year period following these children 7 years after.
Yeah.
Is that the case with this particular vaccine, that it might wane or it will wane? You didn't really specify answering that question.
So yeah, to put it in simple language, it has been noticed that the protection wanes, starts to actually wane after 4 years. By the time the child takes the vaccine at 6 months, so the child take the next vaccine at 7 months, 8 months, get the 3rd dose, then the 4th dose gets at when the child is 15 months. So for spacing a month apart, we call it 28 days, so that the vaccine can actually seroconvert and actually do its work.
Are there fears? I mean, as an agency that is in charge of this vaccination, what are your fears? I mean, you'd have carried out your study and all of that. With the COVID-19 vaccination, what we saw was that, well, most people showed up for their 1st and 2nd shot. When it came to the 3rd shot, a lot of people didn't bother anymore. Do you have concerns such as that with these 4 shots, people may fall along the way? And how do you hope to address that?
Yeah, definitely. We will have some defaulters, definitely. Even if you're sharing money, people will still come and
But then it
not come
defeats the
back.
purpose. So what are your plans?
So it's not about defeating the purpose, it's the nature of human beings. So what we have is a full defaulter tracking system in place. Thanks to the executive director, he had actually given us a strategy which we have actually initiated. It's called Identify, Enumerate, and Vaccinate. What that means is that we're not just going to be talking numbers now. So you're going to come to my house, I have a child that his name is Abba. So you're going to put Abba Garba and his age and where he stays. So that particular documentation would happen at settlement levels. We mean the villages, right? Where our health workers will have access to that. The traditional institutions will also have access to that. Would use that register to track and find the children and vaccinate them. So our defaulter system, we have what we call the tickler box. This is recorded, all vaccinations are recorded on a card. And this card is now being used. So we now, like for the next session, we know the number of children that are coming and who is coming. And we follow them up. So in terms of defaulter tracking, we intend to not just use the cards, we use our IV registers. We also work with the traditional leaders to ensure that they bring these children, because the thing is this, without those traditional support, it's going to be really difficult. So we rely on them a lot.
Well, doctor, while this vaccine is a significant milestone, other malaria interventions like distribution of insecticide-treated nets,
Long-lasting
all these other interventions remain critical. Is there sort of a plan to maybe integrate these measures with the vaccine rollout?
Are we abandoning them?
No, the vaccine is just the last thing that have just come. The tools are there. The tools are there. The anti-malaria, insecticide-treated nets, simple hygiene, clearing of our gutters and all of that, clearing of bushes that actually help. And maybe in the future, we might have to tweak some of these mosquitoes to become mosquitoes that cannot actually transmit. This has happened in some countries. You have mosquitoes, but yes, they cannot transmit this.
We also have mosquitoes that are becoming resistant.
No, we have human beings who treat malaria and don't complete it, and that then it now becomes resistant to treatment.
Great.
Yeah.
Dr. Garba, before we let you go, can we put a figure to how much the Nigerian government is expending on this? Or is this just solely development agencies doing this for Nigeria?
So for now, as at today, I will tell you that the vaccines we've gotten are donations. For new vaccine introduction like this, we usually get donations from our donors, our partners who bring in these vaccines. And after that, by the time it becomes a fully routinized vaccine, when you're now in the system, then the government commits a whole lot of funding. Let me tell you something, the malaria vaccine is a really very expensive vaccine. Really very expensive.
Is that a concern you're raising?
It's more of an awareness to know that because the vaccine is free does not mean it's
cheap.
Yeah, it's free.
Yeah.
It's not on the streets to pick. Somebody's paying for it somewhere. We've looked at the figures over time and looked like if we bring the malaria vaccine into the routine immunization system, we would be spent for malaria vaccine alone, we would be all of our vaccine expenses. Malaria vaccine would take like 1/4. What we know is a problem in Africa, and we're willing to go. The government is willing to commit. So it's a win-win for everybody.
Great. That's a good place to leave it. We'll continue to watch the space as vaccination continues. Fingers crossed, and hopefully sometime very soon, adults can also get theirs.
Yeah.
Dr. Garba Rufai is the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Thank you so much for your time.
Yeah, thank you.